So welcome to the training video for iQudos Prostate Cancer software. Very quickly, just an introduction. Why did we invent it? I'm a urologist and I spend a lot of time looking after men who've got stable prostate cancer. So they've had a treatment, radical prostatectomy, radiotherapy, and 95% are going to be well every time I see them. So that means they're dragged up to the hospital, they're seen, they're well, they go back home again, waste of their time really. And also, it means that I haven't got that time to spend with other people who are acutely ill or need help making a decision. But the problem is, if we send them all to the community and they're not followed up at the hospital, will they get the same follow-up? And that's difficult to know. So we built an expert system which is designed to enable men to be looked after to the same quality standards wherever they are in the community. This short video is going to show you how the software works from the clinical standpoint, not booking appointments, but from a clinical standpoint, and we'll go through it one step at a time. So hopefully it'll be helpful. So just to get on with the software, the first thing to do is, here's the screen that I'll bring up here, and it's a welcome screen. You need to have a password and username which will be provided when you enroll in the system, so I shall type it in. And then whilst this is happening, it connects to the server, which in a hospital or GP setting will be across the NHS N3. And that means that it's kept within the NHS and absolutely safe. Now here we have the main screen, and my mouse is moving. You can see we've got some things across the top which you can use, but you don't need to. This is where you'll be focused upon when you first arrive. So there'll be a list of your clinic patients. There's only one patient listed here, and normally it would say Dave Smith. This chap's got a name set up by the computer programmer, so we know what's wrong with him. But as I say, it would normally be, say, Dave Smith. Date of birth and whether he's booked or not, whether he's attended, click DNA if he doesn't attend, and verify to go on to the next stage. So I shall click on that, and off we go, and it brings up the next page. So here we have the demographic details for the patient at the top. You can show more or less, to have more screen. You can update the patient record if they've got the wrong address for them or something like that. You can change the consultant details from the hospital standpoint. And here is what should have already been assigned as the patient's pathway. So here are all the different sorts of ways that the patient could be looked after. They might be on active surveillance, hormone manipulation, individual PSA threshold, radical prostatectomy, commonest form of radiotherapy, or watchful waiting. And this gentleman is on external beam radiotherapy. Now, if you just wanted to get on with it, you click on Start Session. But actually, what's more likely to happen in reality is the patient will be sat before you in clinic or just outside, and you think, well, I'd like to get up to speed and work out what's happened. So it's much more likely that you're going to click on Patient History over here. And this will bring up, first of all, a short page which describes the main features of the patient history. They were diagnosed here. This was their Gleason grade, and I'll explain that to you more in a second. This is the PSA, prostate-specific antigen blood test, the diagnosis, the staging, and then some scores here to do with some symptoms. Now, to look at it in more detail, you click on Edit, and it will give you a much larger panel of their presenting symptoms and factors. So this area here is all about how the patient got into the service. So it's not what's happening now, it's about how the patient got into the service. Clues here, patient history. So this is the date of diagnosis. Click on this, out comes a little pop-up. You can enter the date of diagnosis. Where were they diagnosed? That's this one. What's their ASA grade? How ill are they? Quite handy this for later stages to work out what treatments they might be able to put up with next. Here's Gleason score. Now, Gleason score is a marker for how evil the prostate cancer was. So the higher the Gleason score, the worse it is, and it's a mark out of 10. And here you can see there's a little drop down to go with that. This is for the PSA diagnosis. It's prostate-specific antigen is what it stands for, and it's a marker usually for the level of disease in a given patient. If it's a prostate cancer patient who's had radiotherapy, they may have a PSA nadir. Now, what that means is the lowest the PSA has ever been down to. What's the lowest it's ever been to? And we use that for some patients to see whether they've got recurrence. Next step is if they've had an operation, what was the date of the operation? And then staging. So These will come to you if you're in the community from the hospital, or in the hospital obviously you'll have the data available. And then if they had a flexible sigmoidoscopy, the date can be entered in here. Again, this section here are symptoms at presentation. So when they arrived, did they have bone pain, did they have weight loss, etc. This information on this page at the moment is not critical for what happens to the patient. The most important arena where it's used is if the patient is in the community and is referred back to the hospital, and it gives everybody a sense and understanding of how the patient got there and what's been going on with their history. The other section is another tab here. You can see in patient history is treatments, and within this you can add records, and you can add a treatment type along with the date, and this is what's happened to this chap. So he started on hormonal manipulation in January 2012, had his radiotherapy in March. So if we just go back to where we were, there's the back button, you'll find that on the various pages, and we go back again, and it will take us back to the main area. So this was where we came in. So that was to get you oriented. So just to go back to patient history again, we'll not start the session quite yet. That was how we edited it before. That's how we go back to where we got from. Now again, across here there are some tabs. So here's a tab which is a synopsis of the patient's most recent blood tests, which you might find helpful, so you can know what's been happening with their PSA. This, if there were previous GP letters, would have copies of the letters that the system's generated for the GP, so you can see the sort of decisions that have been made about the patient. And this area here will only notes that have been sent to the GP before about the patient by the nurse. You'll see more about that in a second. And this section here, are there any internal notes? And the sort of thing which will be recorded here shortly are things such as patient very deaf, allow a long time to reach the telephone, call twice, usually end of garden, that sort of thing. So back to where we came from. So that's the main page you land on. Go back to the entry page, and here's where we were with the patient. So patient details at the top. Here's the treatment they're on. This is the kind of consultation it is. Telephone in this instance. And we'll start the session in anger. So you'll do this for every patient that comes along to clinic. So the session page has a number of tabs again, looking at the different aspects of the patient in front of you. So just to go through it again, patient's demographics, and then a series of tabs. So we've got pathology, clinical, and an area to take notes. So if we start off with the pathology section, these are the sorts of bloods which may be collected for a patient with prostate cancer. So we've got some routine liver function, full blood count, some liver function tests that are salient, and a PSA. To enter a new test, these will often be copied across, but if they're not, to enter a new test, you type in the figure here, and then you choose a test date from the drop down here, and enter those in for the patients. You can see a historical graph of a historical session of the PSAs, or here is a chart. Really the most important one is PSA. These others are a bit more optional, but if you don't enter in a PSA, nothing's going to happen. So in this particular patient, there's a PSA of 1.4. It's been copied across in the system, which you can see here, and the test date was here. So let's assume you type that. Let's change it actually. Let's type it in and put 1.6, and then we'll just click on update because we've changed something on the interface. And we'll just wait for it, and it'll accept that change. There we go. Next, we'll have a look in the clinical section, and this area is the main bit where you will have asked the patient questions, or will ask the patient questions, and it's divided into a number of different areas. So we've got bowel toxicity, urinary, erections, weight, and bone pain in general. So just take one step at a time. You record here whether the patient's had any problems with their bowels, constipation, diarrhea, or bleeding. Just a simple tick if they have. The next section here is the patient concerned about their urinary system? It's waterworks here. I'm sorry, it's a slightly everyday phrase, but it sums it up for most urologists. So you can record yes or no, and that's really the most important bit. If they record yes and you want to, There's actually an international score called the IPSS, which you can fill out with the patient to record in detail exactly what problems the patient's had. And it's quite good for looking back, but it doesn't make a great deal of difference to the actual consultation. But it's good from a kind of thoroughness point of view if you have the time. Similarly, is the patient concerned about erections? And again, there is an erection sheet here, which again is a standardised questionnaire. And we'll say this patient's got no concerns about either. You can enter the current weight if the patient knows it, and there's an important question here. Has the patient lost a significant amount of weight in the last 3 months without trying? Tick that if they have. Next section here is bone pain. Has the patient got bone pain which is continuous and difficult to ignore? Yes or no? And the reason that's important is because prostate cancer can spread to the bones, and patients will have very persistent bone pain if it does so. Then this next section is if sigmoidoscopy is relevant, which at the moment for patients it will not be. So next with the notes section here, we have notes to the GP. So as the person seeing the patient, you can type in anything here you want. Also depressed. I have recommended visit to practice, and this would appear in the letter, and we'll update it again. Whatever you type into this section will appear in the GP letter. It's notes for the GP. If, however, you type something into nurse notes, it will only appear in the system. It will not appear in the GP letter. Yep. So if you want to communicate to the GP, you don't like the follow-up, it's normally defaults to 6 months or whatever it is, you need to type it in here. When you're happy that you've done all the things you wanted to do, you click on Analyze, and what happens is the computer immediately looks at what's gone on with the patient and it generates a letter. Now the actual generation of the text is very quick. It can do hundreds of pages a second, but what it's actually rendering is a PDF, a nice pretty letter with a graph on the back and things like that. So something we can't normally do in the NHS, and that does take a little while to happen. Then up comes the screen, and it will generate a report for us. So there's the patient letter. So as you can see, here's the chap, Mr. Radiotherapy again, and it starts off with how did he get here, what's happened to him, what's happened before he came along today, what have we found. The most recent one is his PSA is 1.6, and it says here, based on the last 4 visits to clinic, been 3 consecutive rises in the level of his PSA as results suggest potential for recurrence. Now this particular one uses the database based on hospitals, so it says here what will we do? I'll discuss this case with the consultant and let you know the outcome in due course. If however it was a patient who was in the community, it would say at the bottom it would say this patient may have recurrence and we suggest you refer him back to the hospital for further consideration. And that would be a cue for the GP to get in touch with the MDT contact member to work out what's going to happen. The letter has 2 pages. You can see here it's one of 2. So if we click on page 2, it will show us the report. You can see here's the nurse's note that I entered earlier on. Also depressed, I've recommended visit to practice. And here is a digest of the PSAs and blood tests, and there's his graph. Now, it may be that at this point you think, oh my goodness, I've entered something wrong. You know, I've made a mistake and I've got something awfully wrong. If you have, it's very simple. You just click on cancel and you'll go back. If you want to print it out, you just click on print PDF. So for now, we'll just click on cancel and it will take us back. And then you can change anything you want. Oh, I didn't want to say that. I wanted to get rid of it. So we'll delete that and then click on update. There's now no note will appear. Wait for it to update. We'll go to pathology and we'll say let's give them a slightly more innocuous PSA. Let's make it 1.3. I've done that in error. Update that again. Wait for it to catch up. And then we'll just now do reanalyze and it'll generate the letter and we'll see if that's made a difference. So one of the advantages is you don't have to dictate a letter, and here's the new letter, and you can now see that the level of the PSA has been relatively flat, and it's much happier. It says the patient's being monitored in the radiotherapy pathway, and his PSA is within acceptable parameters, so that's excellent. It's moaned slightly because we haven't got the other blood test results, and it suggested the patient comes back in 6 months' time. If we go off to page 2, here we are on page 2, you can see that now there's no nurse's note, which is good, and the graph looks much more friendly. So hopefully that's been a reasonable introduction. We'll just go back to the starting point again. So I could say OK there, but for now we'll just do cancel. And we shall go back to the patient list. So it's still there, awaiting completion. So if you get back here and it says awaiting completion, quite important that you spot that. So what that means is you haven't completed the patient. So if you click on verify, it'll take you back into the patient. So there's the gentleman again, Mr. Astroradiotherapy. Click on resume session. Go down to the bottom. And next to analyze, it says complete. So it says, would you like to mark it as complete? Click on OK. And now it's complete. And you'll find close the session.